welcome to beautiful Vienna, Austria's great capital and largest city. This year, Vital Options International took on its 6th year of the on-site coverage of the signature gathering, the essential ESMO ECCO Congress. The European Cancer Congress combined the efforts of the most important European oncology professionals with the aim of improving the prevention, diagnosis, treatment, and care of cancer patients.
The Global Fund did a lot, and we also know that the previous UN resolution also did a lot for HIV, but it did not. We were unable to do the same for NCDs. Now you're saying, you pointed those out as good examples, and how a lot was mobilized and a lot of resources were then released so that action can be taken. What can we do in the area of cancer? How did that happen for the Global Fund? Why was it so successful for HIV at the UN level? And what can we do now as advocates to make sure that we can up the limit, the resources? We want to be able to know what to do, because these are great examples, but we're here to try to find out what can we do? What is our role? How can we help you, maybe? Thank you very much, Andreas.
It's for me to respond. Whether you know, one of the key commitments of the UN resolution in 2011 was that it's basically on the shoulders of the government to put in place a national NCD plan or the cancer plan. So this is the chance for NGOs to really dialogue with the national to push. Yeah, exactly. So it's very much about, and this was the consensus of the head of states, that it's about the national planning on health access to, and we are providing the tools, the essential medicines list, the other tools, costing tools for. You need just to dialogue with the governments and say, look, use what is available, and one point is very important is having enough data for describing the gap. And I'm very grateful to mention that, because and ESMO is doing a big job in describing the gap, the perception survey. We need this kind of data. Otherwise, it is not on the table of the ministries of finance, not only health.
Yeah, that's correct.
You know, there is something else that you can do, and even at the WHO level. So AIDS was one disease, and it scared people a lot. Yeah. Okay? And NCDs are all put together in one basket. So you have diabetes, you have cancer, you have cardiovascular disease, neurologic diseases, they're all put in one basket. And yes, we met together, and we can find common things, but we can also find very different things. And we are all, let's say, sometimes people believe that we are all competing for the same money. And if we are crying out because cancer is important, other people are crying out because cardiovascular diseases are important. And I think what is very important, we at the health professionals, we are trying to get the health professionals together around the NCD, the non-communicable disease. Maybe you should also do the same. Reach out to advocacy groups in cardiovascular areas, in diabetes areas, because there are certain things that can be fought together. I mentioned tobacco. So we a couple of 2 or 3 years ago, we had the World Oncology Forum. Just like we have the World Economic Forum, we had the World Oncology Forum. And we actually brought people from the AIDS arena and said, how come you did it and we cannot do it? So how come people change their habits, their way of life, and we cannot even convince people to stop smoking? And children are starting smoking when they are adolescents. They are increasing their risk of cancer tremendously. And you know, that more than any vaccine would be a preventive measure. And so get together with other advocacy groups, and there's one thing. When you get together, it's very important for certain aspects, but there's another thing that you should do, and that's what I did also in WHO. Remind everyone that cancer is the new epidemic. We are about less than 10 years And in less than 10 years, 1 in every 2 people will have cancer. From those, more than half will come from low middle income countries who are not prepared for this. There will be already now 70% of deaths occur in the low middle income countries. Now imagine what's going to happen.
So we have time for one more question.
I have a mic. Hello, my name is Ananda Plate. I work at Myeloma Patients Europe. I'm a lymphoma patient myself. And I just wanted to thank you, Vlad, for the very nice presentation and the initiative. However, in myeloma, it's really, it's what Bettina said about the expensive drugs, where we have the main problem at the moment. So we have initiated a project at MPE to tackle this. And basically what we found out is that the main reason for which advocacy wasn't being successful over the past decades was that there was no, people didn't know really what was going on in their country. So there was no evidence on what were the barriers and what were the underpinning issues of those barriers. So what is behind not being diagnosed in time? Is it, I don't know, because of, waiting lists? Why don't you get a drug? Is it because of pricing? Is it because of HTA? Is it because the time gap between, discovery of a drug until it really gets to the patient is too long? Why is that? Shouldn't we maybe start, doing protocols and clinical trials in a way that you gather evidence that will afterwards be asked for when you get to the reimbursement point? So all of this to really get that information to the groups that exist nationally, because we think that as an umbrella organization we can't impose anything. On a global level you can't really do things because you don't know what is happening on the ground. So that's our approach.
May I comment on that? Just one thing, there are several reasons for cancer drug shortages and for drug shortages in general. There are manufacturing problems, and there are business decisions, and there are regulatory issues. There are all sorts of things around the supply chain. Now, do you have any idea which one is the most common? Which cause is the most common? I can tell you, I've read a couple of studies. In over 50% of the cases for drug shortage, it was about cancer drug shortages. In over 50% of them, the cause is as unknown. So somewhere on the road, there's something happening.